this fire it should be there, or whatever they do, but they should do a best, no compromise. If you work for 4 hours, then dedicatedly you work for 4 hours and find out something which other could not have find it out, then you will be succeeded. So in one portion of the uterus which is non-developed, the pregnancy was in that non-developed one, and that pregnancy goes to the full term, and that was having a placental problem that was missed on sonography by sonologist and gynaecologist, and that case I had operated. So I had to publish that case.
Yes.
So our team is doing research on that, and we're going to publish that case. Nature's always wanted Earth to be in a feminine way. My goal is that uterus should not be removed in the treatment of PPH.
MedTalks presents Scrubbing In, stories that make a doctor.
Hello, Dr. Gupta. It's a pleasure to have you here. Welcome to MedTalks presents Scrubbing In.
It's my pleasure too.
Lovely. So we have researched, we have just typed in basically your name in Google, and there's so much of data, there's so much information. And also it's interesting to see your YouTube channel as well. Today we have met to understand the person behind this big name, Dr. Mahesh Gupta. And we want to understand the research, the study, the surgical approach that you are so popular for. And also we want to understand the very learned side of yours, which is because of the amazing reading, the extensive reading, the extensive understanding of the human and the mankind that you have. So to begin with, I think the first thing we want to start is by understanding your interest, your inclination for the postpartum hemorrhage, the PPH that you have been working on. If you can throw some light on that, what drives you? What was the reason you were inclined to research and to work so much, to take up such high-risk cases and to take up this challenge? So I think this is what we want to start understanding first.
See, basically, I have been graduated in gynecology in 1987. So it is almost 35 years I've been in this practice. And I'm not attached to any medical college or any teaching post. But in 2008, a world-known doctor, Professor Michael Stark, was invited to Ahmedabad. He is from Israel, basically. He developed a cesarean section technique. So I was then secretary of Ahmedabad Gynec Society, and we kept a live workshop in one of the hospital in Ahmedabad.
Okay.
And that Michael Stark demonstrated the surgeries, 3 cases, I think. So I was inspired by him, and I had seen his surgery, and we were doing almost same thing here or there. So after seeing his surgery, the first thing what I did, I record my surgery on very next day with a video. I asked the videographer to come, and I recorded my cesarean section, and I had seen my cesarean section in 2008. So then I inclined to the surgical part. Then I kept on evolving the various surgical steps. And once upon a time, I was so fast that within 9.5 minutes, I was completing cesarean section from skin to skin.
Oh.
So I communicated with the Guinness Book, and they refused that we are not taking any surgery on speed basis now. So, but I was then remain on the surgery. Then some good friends, they were into the test tube baby IVF. And in IVF, the majority cases are the high-risk cases because of their age, because of their concomitant disease like diabetes, hypertension, or multiple pregnancies. Then they used to refer to me. So in those cases, I used to perform the cesarean section, and I was doing some PPH tackling surgeries. So I have published my first DVD on the PPH tackling surgeries in one of the national conference. And I got a very good success and good fan following on in 2013 or 14 something, because I kept the DVD running in the one of the pharma stall, and we never gave any DVD to anybody. We just asked the doctor to write down their name, address, and mobile number. Then we'll send you. So I got 2,200 this requirement of that DVD. So that boosted my confidence that people are interested to watch the surgeries because everybody is doing that surgery. Then gradually I have shifted to the PPH tackling surgeries. And then I developed a various technique, because in our textbook and in our curriculum, the surgical part was little untouched. Because most of the gynecologists, most of the time, were giving the medicine to control the postpartum hemorrhage.
Okay.
But if India, I believe that if a postpartum hemorrhage can be treated with medicine, then no mother should die. Why mother should die? Because every woman can have a medicine, and every ASHA worker and every nurse can give a medicine. There is no big deal. Then also these mothers are dying. So then I thought that surgery is must. So, but surgeries were little clumsy on those days. So I made a very easy, reproducible, and anyone can do that surgeries. And that's how I have developed the surgery. And first time I presented my surgery in 2015 in an international platform in Vancouver, Canada. And I published my surgery.
Okay.
And then our specialty, there is one doctor called B. Lynch. He first think that uterus can be preserved in postpartum hemorrhage. He was the first person to believe uterus can be preserved by doing such surgery. Otherwise, before that, the most of the time, the postpartum hemorrhage, the uterus removal. So I believe that uterus is a very precious organ for a woman. It is a symbol of womanhood.
Correct.
So it should not be removed. So, but B. Lynch was not that much popular amongst the postgraduates. So I developed a simple technique that with one puncture I can do the surgery on one side. So 2 puncture on 2 side, and surgery will be over in 5 minutes.
Okay.
So, but B. Lynch was not able to make a suture for that, suture material, which is very important. So I contacted one Bangalore-based company. They were readily helped me, and they have made a suture according to my need.
Okay.
And now they are marketing their suture. And now that suture is now having a American patent, US patent.
Okay.
So now that suture can be used worldwide. So now suture is available with the Indian market. So people are doing. And I'm happy to share that few of the postgraduate students are doing thesis on my technique. And they are publishing and depositing to university.
Brilliant.
That their thesis on my technique.
Wow.
So that's why I evolved this technique. And now everybody is doing this surgery.
That's amazing. I mean, that's a huge impact-driven
Yes.
research work done by you. Quite
Yeah.
commendable.
Thank you.
But so what I see is you do not come from a medical background, as far as I know. Do you have any mentors? How did you figure this whole journey out?
Actually, in my family, I am the first medical graduate. There is not any doctor in my distant family. So I entered in the medicine accidentally. Yeah. I was a very average student on 10th standard, but 12th standard I got good marks. But I was interested in engineering. So I took admission in LE Engineering College and I studied there. But somehow that physics and maths, I was very uncomfortable. And mine was the first batch of 12th, 10 plus 2. First batch.
Yeah.
So the admission criteria were not fixed. So one of my friend who was expecting to get a good mark, and he gathered all the admission from all the medical college. But unfortunately, he didn't get good mark. So his mother told me that these admission forms are useless for us. You took. So then I take away that admission form of the BJ Medical College and I just applied. But destiny was there. So after studying 3 months in engineering college, I entered in the medicine.
Okay.
So in medicine, my batch was of 92 students. So my merit number was 91. Second from bottom.
Yes.
So in final MBBS, when the result came, I was second from top.
क्या बात है?
So I got 2 medals from BJMC alumni. In medicine, I was second highest. In surgery, I was second highest.
Okay.
So table turn. When in first MBBS, I was second from bottom, and in final MBBS, I was second from top.
So that's where you figured कि ये तो this is my calling, this is my inclination.
Yes.
Amazing. And then as in how you you were attending the conferences, you were part of the events, and that's how you figured out how you wanted to go ahead, like in terms of figuring out and picking that knack on यहाँ पर कुछ गड़बड़ है, मुझे यहाँ research करना है, मुझे ये देखना है.
Yeah, initially in our days, all this gynec branch was with hand and eye. We were using our hands and we are using our eyes. There was no instrumentation in 88 when I started my practice. So in those days, now our hand and eye become the ultrasound machines. Ultrasound machines become our eye now. And this various laparoscopy instrument become our hand. Those days, it was not there. So in 89, I first bought my ultrasound machine. In Ahmedabad, there are 5-10 doctors who bought this machine. So at that time, we were in dilemma that whether we go to the ultrasound side or whether to remain on the surgical side. But ultrasound was lucrative on those days.
Correct.
So I remain on ultrasound side till 2004 or 5. And I developed as a ultrasound faculty in national level.
Okay.
And then I shifted to the surgical side, particularly after seeing this Professor Michael
Professor and all. Beautiful. So if you are to see the cumulative growth that you have seen in all these years, what is it that you see has changed? Like, as you said, now the technology has also come into gynecology big time. Is there anything you see in terms of the mindsets also of the gynec doctors that has changed or evolved in all these years? How they function, how the working pattern has changed?
Yeah, working pattern has changed in a big way now. This technology has made a difference, one thing. And in our days, the gynecology was only a gynecology branch. Now it has a many subspecialty, like IVF, test tube baby. So now doctors are preferring the test tube baby because it is an office hours job, doesn't have much risk. Second specialty is ultrasound. Now we call it a fetal medicine. Again, that is a office hours job and doesn't have a much risk. Third is now endoscopy. So here the male and female. Female most of the time opting for test tube baby IVF or fetal medicine. And male young doctors now opting for a endoscopy.
Okay.
So nowadays real obstetric work, carrying out deliveries, carrying out the cesarean section, that ratio is getting less and less.
I see.
Because everybody wants to work in a office time. And nowadays it was a different.
So now that brings me to my next question, which is why I asked you this, is if it is for the current generation who is pursuing medicine, who are studying, who are residents or the doctors in gynec, what is it that you think, like what advice do you think you want to give to them? How do you see that generation going forward? And if there are certain advices you have or certain mantras you want to share with them for their success?
See, हिंदी में कहावत है, जब पेट खाली होता है ना तभी माइंड चलता है. तो अभी now in generation everybody is well off. If you see in the now medical colleges, the most of the parents either they are doctors or they are from good family. So they don't have that fire, in their belly. They don't have that fire. So now what now their approach is that now we are a qualified person. We will work for this many hours. We'll go for Saturday, Sunday hangout or a tour, and that is our job. So now they don't have that kind of fire. So they are now just following a pattern. Because many times I ask the young residents, what is your preference? If I ask 10, then 4 says I will go to the IVF. 2 or 3 will say I will go to the fetal medicine, or 1 or 2 says for laparoscopy.
Okay.
So this fire it should be there, or whatever they do, but they should do a best. No compromise. If you work for 4 hours, then dedicatedly you work for 4 hours and find out something which other could not have find it out.
Correct.
Then you will be succeeded.
Get the edge.
Yes.
So, again, in line with the younger generation who are currently pursuing, there's also a big, you'd see the social media also playing a big impact. You being a very senior doctor, you're still managing to have your YouTube channel with a good number of followers. How important do you think it is, or do you think that really helps in helps the doctors in their career goals?
Definitely. Because in our days, we have to refer the books. And all the time, books is not handy with you. And all the time, you can't afford to buy all the books.
And you can't trust the Google Baba always.
Yeah. On those days,
Google was not there.
Google was not there. But now there is so much material on the YouTube is there, and so much good surgery, so much good discussion is there. And every human, it's a psychology. They thrive for acknowledgement and appreciation. So just to have a good appreciation and a good acknowledgement, you have to work. And whatever you are doing something new, that you must share to the public. See, before just a week back, I did one surgery somewhere. And that is probably, I think that it is a first surgery in the world, or rarest in the world. Because we are finding from the net that till that patient, that condition has not been published. Because how we can say that it is first in the world or rarest in the world? We will go for the publication.
Yes, journals and publications.
Yeah. So our team is searching that case is not published. There is a very rare case. Uterus is having a 2 portion. That is called a biconate uterus. A normal woman have a 1 uterus. But in our intrauterine life, our body develop in a 2 part and then come in a 1 part. So it is fuses in the center. Okay. So the same thing happened with the uterus. Uterus will develop on the 2 side and come in on the center, become a 1. So 1 portion there are some condition that 2 portion will remain separate.
Okay.
If you see there is cleft lip somewhere, cleft palate, the 2 portion that is not united in the center. So that is the same reason.
Okay.
So in 1 portion of the uterus, it is non-developed. The pregnancy was in that non-developed one. And that pregnancy goes to the full term. And that was having a placental problem. And that was missed on sonography by sonologist and gynaecologist. And that case I had operated. So I have to publish that case.
Yes.
So our team is doing research on that, and we're going to publish that case.
So it's very important to research, do the documentation, data collection,
and publication.
Superb.
So that should be done by all the doctors.
So again, adding on to this, I've also figured that you are an avid reader. You really, just not your research or the subject-based reading, but also a lot into reading the other books. So can you throw some light on your favorite author or some philosophy that you are so fond of or very deeply attached with?
Yeah, one thing is very evident, that you should have a curiosity for everything. You should like a child. Child is always a curious. So that curiosity should never die within you. So that's why we evolve this kind of surgeries out of curiosity.
Correct.
So this curiosity, we always think that why it is so.
Just always ask the why.
Yeah, why?
Yeah.
So this why question, and with a little rebellious nature, that why these people is saying always go do this thing, that why? Why is saying this? So that brings you to invent something, to read something. So I'm greatly following Rajneesh. I have his very huge collection.
Okay.
So whatever he has spoken till date, I have all the MP4 of maybe 40 or 50 MP4 of.
So how do you think that philosophy that you have deeply
I'm more
understood?
interested in his philosophy and his knowledge related to the medicine.
Yeah, exactly.
Because he has spoken so much on medical side. So I always curious to correlate that what he has spoken and what is in our, particularly our gynec subject, particularly our psychology, parapsychology, or human behavior. So I tend to listen him about these various incidences.
Can you throw some light on a few of those parallels that you have sort of
Yes.
derived?
There was one person, that one rat given birth to 7
Mice. Chota.
mice. Okay. So what the scientist did, they kept the rat on the top, on the this ocean, and take a submarine, and all that 7 kid mice will taken to the bottom.
Okay.
Here the rat was having electrodes on the mind, and it was recorded. So at fixed time, both were given stopwatch. On the scientist with the rat and scientist with the mice in the submarine at the bottom. And fixed particular time that mice were killed, one by one by one by one. So at this fixed time, the rat mind was showing electrodes showing some changes.
Okay.
So that rat was connected to that mice. And that's why in street, if you see that the mother dog is somewhere here or there, but if you go to nearer to the baby dog, the mother dog will come to that place.
Correct. That bond is there between them.
That they are connected with the mind. So the science of Reiki comes from there.
Correct.
So these are all recorded things.
And I think this is a very important perspective for a gynecologist
Yeah.
because you're instrumental in that bond.
Yeah, so I used to read these kind of things and listen to these kind of things from Rajneesh,
Superb.
because gynec is altogether something nature's thing. It is a pregnancy is a physiological thing. If there is some flowers flower is there or some fruit is there, it is nothing but it is a conception, intercourse, one kind of intercourse. The same thing will happen in the human.
Yes.
So without that, no flower can
Bloom
grow,
or, yeah.
no fruit can develop. So I was reading this kind of the thing that how this pregnancy
And the beauty of nature that
Yes.
goes.
So
the
nature
femininity
always,
of nature.
nature always wanted to expand. Nature always wanted to expand.
Superb. I think, they also say, like how you had discussed with us initially, nature's always been on the feminine side of it.
Nature's always wanted Earth to be in a feminine way. And for that, just I'll give you the example that Mahavir Swami, Gautam Buddha, Bhagwan Sri Ram, and this Krishna, they never had a beard.
Uh-huh.
In photograph. They had beard.
Haha, but like you would not see.
Yeah, have you seen the Mahavir Swami with beard? Have you seen Buddha with beard? Have you seen Ram with beard? Why? Because if you want to go to the God or a nature or whatever, you should become a feminine. Because a female can have a patience. Man cannot have a patience. So to reach something, you should have a patience. So that's why all artists have not given a beard or mustache to this our God.
Interesting.
Otherwise, Ram father was having a beard.
Yeah.
Dashrath
अभी
and
आप बोल रहे हैं तो I can now correlate.
everyone has a beard. Why this not having a beard? You should go for you should have a feminine way. If you become a feminine, then you can act. Female is always a वो ग्राहक है. फीमेल ऑलवेज एक्सेप्ट थिंग. फीमेल कभी किसी पे आक्रमण नहीं करती है. आक्रमण तो पुरुष ही करता है. फीमेल तो उसको रिसीव करती है और रिसीव करके वो बढ़ाती है.
राइट.
फीमेल इज ऑलवेज रिसेप्टिव.
Still there is strength.
Yes, and that strength expands everything. To procure a child, male is accidental. Male not required. It's only female.
That's coming from a gynecologist,
Yes.
a male gynecologist.
Because IUI can make any woman pregnant. IVF can make any woman. There is no need of male at that time.
True.
So male is aggressive. Aggression. Female is always receptive. And when you want something, when you want to achieve something, you have to be receptive.
Big point.
Because aggression will always make you tired. Aggression always makes you tired.
Agreed.
But receptive nature will never make you tired. So that is a very long story because
But it's very beautiful, very in depth. Enjoying it.
Yeah.
Loving that energy that I'm getting, the vibes.
And that's why in the world, if you see any in creative field, say the chef in hotel, say a poet, say an artist, females are never there. All male.
Most of it, yes. These are men driven.
Why?
Dominated.
Yeah, why? Because female are not interested. Female is interested is her biggest creature, that is a child. Once the child is produced by a female given a biggest creation in his life.
That's true.
So then she is not interested in this all painting and making food. They never compete with the male in that sense, because she has a biggest creation. She has a biggest power to create a thing which no instrument, no computer, no machine can create.
Beautiful. I think I'm loving this perspective of yours coming from the mouth of a gynecologist.
Yeah.
It's beautiful the way you've respected, understood, and like it's just not the science. Your knowledge of science is backed by all this reading of yours.
Yeah, that was a side talk. I'm more into this. I'm working for womanhood and women's health in India, because my subject is postpartum hemorrhage.
So what's the future? What are your plans now? As you said, you're working on the PPH.
Yeah, I'm just creating awareness. And now our second, my goal is that uterus should not be removed in the treatment of PPH. See, if there's a damage in kidney, if there's a liver, any surgeon will remove the liver? Any surgeon will remove the kidney? Why we should remove the uterus? So that should be a last resort.
Correct.
To save the mother for treating the PPH.
Super.
So for that goal, I am working there. Don't remove the uterus. Uterus is a very precious organ. It is a symbol of womanhood for a woman.
Brilliant.
So that surgeries I am developing. I am developing more surgeries about our now condition which is coming up very fast. That is called placenta accreta spectrum. That is a very difficult condition, horrible condition.
So that you think is the future of
Yes.
gynecology.
Yes.
Anything else you think that's
Future of gynecology is are conditions which are created by the gynecologist. This is the placenta accreta spectrum is created by the gynecologist because of multiple cesarean section. The scar pregnancy, because it was not much given in depth when we were student. Because this was not a
CS was
condition.
not that prevalent.
Yes, that much
common
prevalent.
that time.
And that was not much serious on those days. Like our scar ectopic pregnancy is very common nowadays. So we have to work on that now. Because now the pregnancy was considered to be a physiological or normal. Pregnancy क्या है? बच्चा रहा और बच्चा आ गया. But now every pregnancy is with help of the gynecologist, and it is precious, and it is many times it is pathological also because of the aging of the woman,
Correct.
because of this multiple tried of test tube baby centers treatment, ART, that is called ART conceived babies. And patient is having other concomitant diseases like hypertension, diabetes, and other diseases.
Lifestyle related.
Yeah. So all pregnancies are now very precious and many times pathological also. So needs special attention.
Superb. Glad to know that. So I think in the closing section, as we've understood everything, we've understood your journey. We have understood your approach towards it as a gynecologist and the research that you're working on. We usually try to end with some very fun questions, which sort of we dive into the lighter side of yours. So we have written down a few questions, and are you ready for it? Then we can ask you some fun questions. Okay, so the first question is, any medical filmy moment that sort of makes you feel ये तो नामुमकिन है?
ऐसी तो बहुत सारी है, पर वो एक नसीब फिल्म अमिताभ बच्चन की फिल्म में देखा था. 3 लोग सो रहे हैं, वो ब्लड डोनेट कर रहे हैं, वो ब्लड अपने आप ऊपर जा रहा है और एक बॉटल में होके वो उनकी माँ को ब्लड नीचे आ रहा है. दैट वाज अ वेरी फनीएस्ट थिंग. एंड पीपल यूज्ड टू क्लैप दैट सीइंग बाय दैट सीन. पीपल यूज्ड टू क्लैप. दैट इज अ मोर फनियर.
Correct. The best compliment that a patient would have given you?
Best compliment that it is usually with all gynecologists that patient came with that kid and sorry ये आपका बच्चा है. But some patients now after, because my now second generation is coming as a patient, many patients they used to visit just my hospital that I was born here.
Beautiful.
Yeah, that is something, and they keep name of the hospital as their child name. That is a big compliment.
Right.
And some patients, they when they survive, they used to send me the video of their that day of operation. One of the patient, we did surgery in a very high risk. It was a third surgery in 36 hours. And ultimately that patient remained on ventilator for 33 days. And that patient survived. So on 14th of April, they sent me the video of their child and of their couple with a box of sweets.
Beautiful. That really makes it all worthwhile. Superb. 3 most common words that you use in the OT? Are you short-tempered?
No, I'm not much. Surgeons are usually short. All surgeons are short.
It's required because you're dealing with such high risk. You can't.
So sometimes we get angry, but by passage of time, see, surgery, I believe it is like a car driving. So it is called a cognitive reflex. So cognitive reflex, when you are driving a car, when you are learning a car, so your attention on the steering, on clutch, on back view mirror, on rear view mirror, all everywhere at the same time. But once you are experienced car driver, then just your attention is on the road, and all other things are going on a spinal level. You don't know that you are seeing in the back view mirror, you are seeing on the side view mirror. That is all the spinal level. The surgery is on when it comes to the spinal level, then the surgery will be enjoyable.
True.
It will not be stressful. Surgery should be like a just a routine work. It should not be a burden or a stress on a doctor when they are doing surgery. So when they become so experienced, then the surgery, they can enjoy the surgery. They'll feel light after doing surgery. They should not feel heavy after doing surgery. That is for youngsters. So you do so much practice that it becomes enjoyable. Then you enjoy the surgery.
Superb. So if it was not the surgeon that you are, any other field that you would have been into? I know you said engineering,
Actually,
but
yeah,
if it was just
on-
medicine, any other speciality?
Looking to my 10th standard result, I applied for auto mechanic, scooter mechanic in some auto college. But somehow I passed my 10th standard. Otherwise, I would have been a scooter mechanic.
Oh my God. And we would have missed out on a on a major surgeon.
Yeah.
So lovely that it didn't happen. Next one. A superpower that you think you can have as a surgeon or you would want to have as a surgeon if you were given a chance to pick any superpower.
See, when you are dealing with any disease, it is always unpredictable. So I think no one should feel that he is a super boss or superpower. Because when things change, you don't know. There is a basic difference between anatomy and a pathology. Anatomy is always predictive. Means eyes are there, always has to be there. Nose is there, always is to be there. That is called anatomy. But when there is some problem, it is called pathology, then everything is different. So when you are dealing with pathology, you don't know which side you will go. So I think one should not go for a feeling of a superpower. You should be very always humble. And I think most of the surgeon, most of the time, pray to the God before entering in the operation theatre.
I agree. I have seen
Most
that
of
too.
the surgeon.
Right. Absolutely. Any key takeaway that you would want to give to I know we have discussed it at depth, but maybe in few words or any key takeaway you have for the younger generation?
Yeah, for a younger generation, I always believe that any success is not a final or any defeat is not a fatal. You'll always get a chance. Just I'll give you a simple example that I encourage my both the son to go to the sports of a team sport, not an individual sport. I never encourage them to go to the tennis or a table tennis. I always encourage them to go to the football. So they will have a team spirit, one thing. Second, this habit is to help our colleague. And third thing is, no defeat is a final defeat. You will get one more match to win. So if today's in scenario, the youngsters think that this is a last, I got a last chance, and they get frustrated. And that's why they are going for this either bad step like suicide or some addiction. So no defeat is a last defeat. You'll get one more chance to prove yourself.
Correct.
So I used to send my son for a football team in Ahmedabad.
That's a very good
So they think,
team spirit.
Yeah, team spirit.
That builds up.
Sport or inter-player relationship and final result.
Yes. And that really helps because I think in medicine, when you're treating patient, it's not always one doctor's work. There are multiple areas involved.
Doctors.
So that's a very beautiful vision. And lastly, a closing note or a saying or a phrase that you live by.
No, always enjoy today. Forget about the tomorrow, and don't think about the past.
Superb. Thank you so
when
much.
you are thinking about the past, that means now you are becoming old.
Good point.
Yeah.
Superb. Thank you. Thank you so much.
Thank you so much. It was a pleasure talking to you.
And you're amazingly passionate about your field. And that's something I think it's a major takeaway, a key takeaway for me today, that with passion you can achieve and you can conquer mountains. So thank you so
Thank
much.
you. My pleasure. Thank you very much.